Ginger is not only an aromatic spice that adds spice to dishes around the world, but also a valuable medicinal plant used in traditional medicine for thousands of years. It is known for its anti-inflammatory and antioxidant properties, as well as its ability to relieve nausea and improve digestion. The purpose of our video is to reveal the lesser-known side of ginger. We are investigating situations where the use of ginger can be not only undesirable, but also potentially dangerous. For example, people with stomach diseases such as peptic ulcer disease should be careful with ginger as it can exacerbate symptoms. It is also important to know that ginger may interact with certain medications, including anticoagulants, which may increase the risk of bleeding. We invite you to join us on this educational journey to learn more about when and why ginger should be avoided and how to use it wisely and safely. Subscribe to our channel so you don't miss this and other interesting videos. With this in mind, let's move on to talking about 9 cases where ginger should be avoided. 1. Blood clotting disorders. As mentioned, ginger is widely known for its anti-inflammatory and antioxidant properties, as well as its ability to relieve nausea and improve digestion. However, its effect on blood clotting requires attention in certain medical conditions. Gingerol, the main active compound in ginger, has properties similar to aspirin, known for its anticoagulant effects. Gingerol inhibits the synthesis of thromboxane, a substance that promotes blood clotting and narrowing of blood vessels. This makes ginger useful for preventing blood clots and improving blood flow, but also increases the risk of bleeding in people with clotting disorders. That's why it's important for people with blood clotting disorders such as hemophilia to be careful about eating ginger. Hemophilia is a hereditary disease in which blood does not clot properly, which can lead to prolonged or spontaneous bleeding even after minor injuries. Eating ginger can worsen these symptoms, increasing the risk of serious bleeding. Thus, before adding ginger to the diet or using it for medicinal purposes, especially if you have diseases related to blood clotting, you should consult a doctor. The doctor can assess your individual risk and give recommendations on the safe use of ginger in your particular case. 2. Ginger affects blood sugar levels, which makes it potentially beneficial but also risky for people with diabetes. Studies show that ginger helps to improve insulin sensitivity and help reduce blood glucose levels. This is useful for controlling sugar levels. However, if a diabetic is already taking medications to reduce sugar, adding ginger can lead to hypoglycemia, a condition in which blood sugar levels drop too low. In addition, as already mentioned, ginger has blood-thinning properties due to the content of gingerol and salicylates. This can make diabetes control more difficult, as any bleeding or injury can lead to more serious consequences for diabetics, especially if they take other medications that affect blood clotting. Finally, although ginger is often used to improve digestion, in some people it can cause side effects such as heartburn, stomach discomfort, or diarrhea. In diabetics, who may already suffer from digestive problems due to their disease, ginger can exacerbate these problems. It is important that diabetics discuss the use of ginger with a doctor who can help assess the risks and benefits in the context of their individual health status and current treatment. 3. Problems with the gallbladder. The gallbladder plays a key role in the digestive process, accumulating and concentrating the bile that the liver produces. Bile is necessary for the emulsification and digestion of fats in the small intestine. The anti-inflammatory and antioxidant properties of ginger may be beneficial for reducing inflammation and protecting cells from oxidative stress. But for people with gallbladder problems, especially with gallstone disease, it is necessary to be careful when using ginger, as it can worsen the symptoms. Do you like our video? Before we move on to the next point, don't forget to like and subscribe to our channel so as not to miss new informative videos. 4. Heart disease. Ginger has a number of properties that affect the cardiovascular system. It stimulates blood circulation and potentially lowers blood pressure as well as affects heart rate. Ginger dilates blood vessels, which improves blood circulation and leads to a decrease in blood pressure. However, if a person already has heart problems, such changes in blood circulation may be undesirable, since the heart may not be able to cope with changes in exercise. For people with heart disease, especially those who suffer from an irregular heartbeat or have a history of heart failure, changes in blood pressure or heart rate can worsen their condition. This can lead to an increased risk of heart attack or stroke. Ginger contains compounds that thin the blood, such as gingerols. This enhances the effect of drugs designed to thin the blood, such as warfarin or aspirin, which increases the risk of bleeding. Therefore, people taking these drugs should be especially careful with the use of ginger. 5. Medical interaction. Ginger can interact with various medications, and this interaction can affect their effectiveness and safety. It is especially important to be careful for people taking medications that affect blood clotting, blood pressure, and blood sugar levels. Ginger has properties that enhance the effects of anticoagulants, blood-thinning drugs, such as warfarin and aspirin. This can lead to an increased risk of bleeding, especially if ginger is consumed in large quantities or in the form of concentrated additives. Since ginger can lower blood pressure, it can enhance the effects of drugs for the treatment of hypertension, which can lead to too low blood pressure, hypotension. Ginger affects blood sugar levels by enhancing the effects of drugs to lower glucose levels, which can lead to hypoglycemia. Blood sugar levels are too low. 6. Weight deficit. Ginger is known for its beneficial digestive properties, including the ability to reduce nausea and inflammation. However, these same properties can have an effect on people suffering from weight deficiency, and here's how. Ginger stimulates digestion, improving intestinal motility and promoting faster digestion of food. This is useful for relieving stomach discomfort, but for people trying to gain weight, it means less time for food to stay in the stomach and, as a result, fewer calories to digest. Ginger is effective in reducing nausea, including morning sickness and nausea caused by chemotherapy. It also has anti-inflammatory properties. Although this is positive for overall health, people with a weight deficit may find that reducing inflammation and nausea does not contribute to increased food intake, which is necessary for weight gain. Some studies show that ginger has appetite-suppressing properties, which can be a problem for people trying to gain weight. If ginger reduces hunger, it can lead to a decrease in the amount of food consumed and make it difficult to gain weight. 7. Pregnancy. And now, consider ginger, shrouded in a halo of contradictions during pregnancy. On the one hand, ginger has been praised for centuries as a savior from toxicosis, helping to tame nausea and vomiting. On the other hand, a shadow of doubt darkens his reputation, highlighting the potential risks associated with overuse. Some studies, like alarm bells, suggest that uncontrolled ingestion of ginger can increase the chances of miscarriage. Being a blood-thinning elixir, ginger is fraught with the danger of increased bleeding during childbirth. A pregnant woman's sensitive tummy may react to ginger with heartburn, bloating, and other unpleasant sensations. You should not get carried away with ginger in significant quantities on your own, being in an interesting position. Before using ginger in any form, be sure to consult your doctor. He will help you make an informed decision. Number 8. Low blood pressure. Let's talk about the relationship between ginger and low blood pressure, a topic shrouded in ambiguity. On the one hand, ginger, like a magic elixir, is known for its vasodilating properties, lowering blood pressure. On the other hand, the question arises, how does this affect people who already suffer from hypotension? The secret of ginger lies in its active ingredients, which stimulate relaxation of blood vessels, thereby reducing blood pressure. Ginger can also affect the production of hormones and neurotransmitters that regulate blood pressure. In some cases, this can lead to an even greater decrease in pressure. People with hypotension should be careful about using ginger and be sure to consult their doctor. 9. Operation. Now, let's look at the relationship between ginger and surgery. Before any surgery, doctors recommend avoiding the use of certain foods and supplements that may affect the course of surgery and the healing process. Ginger, having a blood-thinning effect, can increase the risk of excessive bleeding during surgery and complicate the healing process. Ginger affects blood sugar levels, which is especially important for diabetics who are about to undergo surgery. In some cases, ginger can interact with insulin and lead to undesirable consequences. Important: 2 weeks before surgery, you should stop using ginger in any form, including supplements, teas, and culinary use. In some cases, the doctor may recommend giving up ginger at an earlier date. Ginger is a versatile and effective spice known for its numerous healing properties. But, like any product, ginger has its contraindications. With the right approach, ginger will become a safe and effective addition to your diet, bringing you many benefits. If you like this video, don't forget to like and subscribe to our channel to receive even more informative videos. Thank you for watching. Taking care of your health is our main goal.